You are here for the Connecting the Dots, Optimizing Human Capital Investments for Better Business Performance webinar. This webinar is part of our Return to Work, Stay at Work series, and we're glad to have you here today. My name is Tanya, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar is made possible through the support of the Community Grants Program through the BC government, as well as through donations and memberships to the Canadian Institute. As I mentioned, my name is Tanya, and I'll be moderating the session and handling the Q&A. And unfortunately, Dr. Bruce Sherman was unable to join us today for the presentation, so it's with great gratitude that we thank Dr. Wendy Lynch for doing the full presentation instead of just half of it like she had originally intended. For almost 30 years, Dr. Wendy Lynch has been making the connection between human and business performance. Her career has included roles as faculty at the University of Colorado Health Sciences Center, Vice President of Strategic Development at HCMS Group, Principal at Mercer Human Resource Consulting, and on the board of directors for 2 publicly traded companies. Now Dr. Lynch serves as co-director of the Center for Consumer Choice in Healthcare at Alterum Institute, and she also runs her own consulting firm. Thank you for being here today, Wendy.
Thank you for having me, and I will pretend to be a physician for half of the time, but luckily there's no real diagnosis or treatment involved, so I don't think anyone will be harmed in the process. And my colleague Bruce Sherman sends his apologies, and I know he owes me, so I have to think about what I'm going to demand in return. So today we're going to talk about the connections between human capital and business performance. And our focus here is on the ever-broadening perspective that people have about how humans are connected to the business, and how HR is starting to think of this in a slightly different way. Now, some of the things that I have learned in the past 10 years have come from starting to study market economics, and having originally been in the statistical world, I knew that people made fun of statisticians, calling it statistics and all of those other nice names, but I never knew exactly how much people disliked economists until I started studying it. So I thought I would share a few of my favorite economist comments. If all economists were laid end to end, they'd still never reach a conclusion. We'll try and avoid that. And then the worst or best one, depending on your perspective, if an economist and an IRS agent were both drowning and you could save only one of them, would you go to lunch or read the paper? So I'm not sure if our neighbors to the north, if you feel the same way about your tax agency as we do ours, but I'm guessing that applies there as well. So when we think about human capital, part of the way to think about it is that human capital, the value of a person to an organization from a financial perspective, is in the return of how much more value does the worker produce than the company invests in him or her. Is there a net gain for everybody, not just for the organization, but for the individual, so that we see a overarching value to what an individual produces? And one of the concepts that has been very important in my work over the past decade or so is the understanding of what human capital really is. And one of the definitions that's helped me is that human capital is the inherent reservoir of capabilities, of capacity that a person owns. And it's intrinsic to the person, and that person is the only one who can grow it and nurture it and care for it. And it consists of 3 assets, and those are the person's skills, the person's motivation and the person's health. And what's unique about these is that one cannot make somebody more skilled or more motivated or more healthy without their participation or at least permission. So I don't become more skilled unless I invest in it. I don't become more motivated or healthy either unless I invest in it. And so if we're thinking about the people we want to hire and keep and nurture in an organization, we want them to be capable and committed and able on any given day to achieve what they need to achieve. So in the U.S., for sure, and I think to some extent in Canada, we have focused a lot on employee health. And we've focused on it here a lot because of the cost that that is associated with having insurance and treating health issues, but also because we know that health can have an impact on work, and because we have felt that there is an ability to intervene and improve how well people are performing. Well, sometimes it's a straightforward kind of an equation such that we can correlate the impact of poor health on direct medical costs or pharmacy costs. And so the cost now in the U.S. for a family of 4 is approaching $20,000. It's a crazy amount of money. And so employers are certainly paying attention to where high well-being is associated with lower costs and lower well-being is associated with higher costs. And so it becomes a focus because we know that there is a cost component. But there's also some interesting relationships between healthcare costs or health or business outcomes that aren't necessarily as straightforward. So, for example, in one company where I was involved in some analysis, we were measuring the total benefits costs, which included their absence rates, disability, workers' comp, and medical. And this company actually was on many conference panels, and they were talking about how they had kept their medical costs and benefits costs flat for a 2 to 3 year period. And they were very proud of it and attributed it to improvements in wellness and dedication to condition management. But starting in the third quarter of 2007, all of a sudden benefits costs skyrocketed. And it's obviously not necessarily that we can conclude that everybody got sick on October 1st of 2007, but instead one of the things that happened was that there was a hiring freeze, and I apologize, the formatting, this dotted line should be right at that point. There was a hiring freeze and a lot of concern on the part of employees about whether or not their jobs were secure, and this was right before, this was the early stages of the recession. And so what happened was that as they stopped hiring people and even started to announce the potential of layoffs, there was a significant increase in the utilization of benefits. So this was not related necessarily to health, but it was related to the economic and business climate. So the next example that I have that makes the health factor even more interesting is we looked at a company where the rate of lost time, and this was all absenteeism and leave and disability, was tracked for a 24-month period. And what I'm showing here is 3 groups of people. There was a group that we show here in red. There's a group that we show here in dark blue, and a group that we show in light blue. And so the question for us is, what is going on with this light blue group where they had an almost 200% increase over time in absence? And what we found was that anybody who was continuously employed is in the dark blue. The folks who were newly hired are in the red. And the folks who were getting ready to quit or who were going to be fired in the 6 months at the end of that period had a dramatic increase in their use of lost time, and it was not related to health status. So in this case, the use of benefits, again, was not health, but it was the turnover or job fit or job performance issues. So it's another example where health isn't necessarily the straightforward cause of even what you would consider to be health-related benefits. So another example was an example where we saw a significant blip in the rates of certain kinds of surgery, knee surgeries, gallbladder surgeries, and hysterectomies. And so we were looking at, if you see this rate in the fourth quarter of 2004, and then the subsequent drop in 2005, we were looking at this pattern of increase. And for those who are familiar with some of these surgeries, what's consistent about these surgeries is that they are discretionary in terms of timing. So because they're non-emergent, excuse me, you can delay them or speed them up by a few months sometimes. So what happened here was that the company announced that they were going to convert to a different type of health plan where people have a health account, like a health savings account or a health reimbursement account, and that the start of the health reimbursement account, so they're going to have a high deductible and it will be their own money that they're spending starting in 2005, that as soon as people knew that they were going to have to spend their own money, they hurried up their surgery and had it in the quarter before the end of the year. So again, even though this is health-related, the cost patterns are related to plan design, not health status. This is also an interesting one, a company that we worked with that had a small division that had a problem with sick leave. And they had an extreme number of sickness absences each month for a small group of people. And so we did something at the beginning of 2009 that reduced the sick leave by about 70%. And I had people ask me whether it was something related to health or something related to hand sanitizer to keep people from transferring illnesses. And actually what it was we implemented a pay-for-performance reward system where people could earn bonuses for getting more work done in that month. And so not only did they improve their performance by 30%, but they also reduced their absenteeism for sick leave by about 70%, which was simply related to being more motivated to being at work, not necessarily that they had as many illnesses in that year before. And lastly, another example of health outcome is a study that showed that controlling for age and gender and chronic illnesses and household income and a variety of other things, there was a group of people who over a 4-year period improved their rates of exercise by 30% and improved their self-rated health status by 41% after a particular event happened in their workplace. And once again, when I talk to students, they guess that it's a wellness program or some other type of intervention. And really what it is was that at that workplace, they improved the work climate in such a way that managers gave people more discretion over their own job tasks. So they had the highest increase in job discretion, and that was associated with taking more control and discretion over their own health as well. So all of these examples are simply to have us think about what the implications of health are and actually what the interventions might be that help individuals be healthier and perform better, and that those things are not necessarily straightforward and compartmentalized into the health improvement categories or safety categories or accident prevention categories. They are much broader than that. And there's a story that I like to tell. It's one of my favorite stories. That in World War II, there was a group of weather forecasters, and they were looking at their own data and decided that their predictions were no better than if the general had flipped a coin. So they were helping the general plan when, there should be air raids and there should be different activities, and they really were failing. And so they offered their resignation. And they got the following response back. The commanding general is well aware that the forecasts are no good. However, he needs them for planning purposes. And so I often think of this story when I talk to HR managers or health managers at corporations, in that if we are using reports that simply tally up rates of illnesses or injuries, are we ignoring much broader influences, either the work climate or the economy or compensation or benefits design or a variety of other things that may be influencing the rates at which people are either using care or experiencing bad outcomes? And so if we're going to think about these things in a different way, those new ways of thinking about it may actually change the outcomes that we get. And so one of the ways that I like to think about it is that health is certainly important, but it's just one part of human capital assets and one part of all of the influences. And that benefits costs are, again, important, but it's only one part of business performance. And so if we are looking at them in isolation, we often miss opportunities that we could find. So another way to think about the business value is to do some, I call human capital math. So at least in the U.S., the focus is on healthcare costs, which are huge, as I mentioned. But we could also do this for absence costs, or we could do this for injury and safety. But if we look at a typical cost of healthcare and we compare it to how much somebody is paid, and so we can again make the parallel to some other another cost. But let's say in the U.S. for a lower compensated individual, the ratio of the cost of healthcare may be 1 to every $4 they're paid. At the high end, let's say investment banking, it may be 1 to $15 that they're paid. And when you look at the organization, the way that the math works out when we hire people is that we expect a certain ratio of revenue or, if not revenue, output that is sometimes ranges from 2.5 to 1, which can be at the low end, to 10 to 1 in, again, investment banking and some of the financial industries. And so for every dollar that we're spending on healthcare, we're expecting the person to generate somewhere between $10 and $150 in revenue. If we translate that into an overall cost, we might expect the person who's getting paid $24,000 versus or $90,000. We expect them to be producing value of $60,000 to $900,000 in value for what we invest in them. And it is much more feasible for me to influence that revenue side in many cases than it is for me to squeeze the $6,000 on the bottom end. And what happens is when I help people focus on the performance end, then that makes it more relevant to them on why they want to protect their own human capital. So what we hope to do when we look at this in a broad way is we hope to help people understand how their health and motivation and skills influence their revenue production. And when we only focus on health and we say we want you to use less health care, we want you to stay healthy, then we're ignoring these other two components, which is that if they're not committed and if we aren't keeping up to date on what kinds of skills and capabilities the person needs, then we cannot possibly handle the burden of what an individual is producing by simply trying to focus on health. So there is a question that we can ask ourselves, and that is, how are we talking about health and safety? And for what purpose are we focusing on it? Is it because we want to recruit and retain the top talent? Is it because we want to prevent costs that we could avoid? Is it because we really believe that a healthy person will thrive and provide more value to the organization, and by virtue of doing so, get more value in terms of higher pay and better skills and more opportunity? And so we have to think about this in a much more global sense than simply narrowing our perspective down to very specific illnesses. And so I often ask employers who are focusing in one area, are you looking only at one thing, health, skills, or motivation, or are we trying to focus on the broad combination of all three? So what's interesting is that when we talk to employers and businesses, what we find is that the cost of taking care of people, their wages or their health costs or their workers' compensation, we see all of those things in the human resources category. But yet, when we really want to know how well people are doing, which is the true value side of the work output, it's often housed in operations. And so we too often do not see a connection between these two. While again, it's much more likely we're going to find some kind of an impact here where it's a $60,000 to $900,000 output number, than that we're going to narrow it here. And so we need to be thinking about both. And so part of what's happened, and we've seen this more broadly, is there's been a broader focus recently on the idea of well-being. And for now, I won't get into a debate, which would be an entirely different talk about what's included or not included. It can be as broad as including spirituality and social and emotional health, or it can simply be a broadening beyond physical and mental health to include one's financial security and safety and engagement in one's work. But we're starting to see some very interesting associations between well-being and workplace performance. This was an analysis by a company called Healthways, where they measure well-being over time, and they correlated well-being for a large number of employees, about 10,000 employees, and they looked at the average well-being score and the rate at which their supervisors rated their performance as fair, successful, outstanding, or exceptional. We also see that in surveys of leaders of organizations that well-being is considered to be a big deal, and it is part of the identified drivers for keeping people engaged in their work. There is no indication here of health specifically, but more about a broader perspective on, in general, their general well-being, their human capital in terms of skills and capabilities, the organization's reputation for social responsibility. And so we're seeing that engagement is related to how people are treated and the opportunities that they're given. Because really what people want in general is to feel like they are a part of the team and not simply one cog in the large mechanics of an organization. Another example, again from Healthways, to give an overview of what this is showing us, there is an overall well-being score for all of the employees at Caterpillar Corporation. And the business units were ranked from top to bottom in terms of their overall well-being score for that unit. And then the sub-scores are listed here, their life, emotional, physical, behavior, work environment, and access to health care. And what they did was they correlated it with an internal measure of output for that business unit. And what we see is a direct correlation with the highest business units in terms of well-being were also the highest business units in terms of actual production output, and the lowest were the lowest. It's a reasonably strong correlation, but as you see, not perfect. But it's one more piece of evidence connecting the overall life situation of the individual and how well they do at work. And so we will include at the end references to 2 articles that Dr. Sherman and I have written and published, where we talk about how all of these things are related, how one's individual well-being, how the workplace practices and design of policies, and how the one's actual job roles and career roles all influence an overarching culture that gives us an indication of what may happen with regard to the person's costs, how well they perform, and how the businesses perform. And we've seen even more support for this argument according to Gallup, who does employee engagement surveys across a whole variety of businesses. They looked at a comparison of those businesses and found that the businesses with the highest, in the highest quartile of employee engagement scores had 20% higher productivity and profitability and 10% higher customer satisfaction, and had significantly lower turnover, absenteeism, safety problems, and quality defects. And the effect sizes are quite dramatic, with these being 40%, 50%, 60%. So again, you will see in the articles, if you choose to look more closely, that we've suggested some of the types of business performance metrics, both from the individual level as well as from an aggregate level, that can be used to start to correlate the individual's health and well-being characteristics with the output, so that the business can understand the ways in which health influences performance at the individual and at the business level. So one of the interesting studies that actually started our work was a result that Bruce had, where an organization looked at the healthcare costs of the business units and also the production waste of those business units. And the less waste, the better, and the less waste, then the better the value of their output. And what he found was that the business units had a direct correlation along the lines of costs and performance. Now, his conclusion, and we've had several debates about this, his conclusion was that as people get healthier and require less care, that their performance improves as well. I have a more general, non-causal kind of a conclusion, which is that circumstances in which people thrive include circumstances that will help them stay healthy and use care wisely, and also to help them perform better. And that those circumstances may not be one causing the other in these two things, but it could be that that's a much more functional work setting, and that overall well-being and human capital are valued. So we see those kinds of outcomes. So we do enjoy having that debate. So I'm sorry he's not here for me to make fun of. Say nice things about. So the strategies that we often talk about are to think about the overarching alignment of human resources policies, to look at data analysis in a way that doesn't focus just on health, but also business value, and then to think about ways to integrate metrics that are often in different parts of the organization. And one of the ways that I like to talk about policy is just a general assessment of whether or not employees are rewarded for performing well, whether they're rewarded for showing up, and they're rewarded for staying healthy. Now, those don't have to be monetary rewards necessarily, but there has to be a value to them for doing these things, or a consequence for not doing these things. Otherwise, it's hard for someone to get up in the morning and be motivated to grow and protect their human capital. So we will look at both the value, the benefits, and the consequences. So if we look at being rewarded for performing well, one of the assessments that I do of organizations is whether or not people can earn bonuses for doing well, whether they can get promoted, get more opportunities, get paid better if they do better than others in their organization. Do they get to be recognized or rewarded in some way if they save the company money, if they recognize waste and try and reduce it? Do they share in profits if the company is doing well, either in opportunities or in more training or in some other way that people get to share in the celebration of success? And does the company reinvest some of what they earn in better training and advancement for individuals. So the bottom line is, do you even measure how well a person is doing? And is there a function of making sure that performance assessment is straightforward and understandable by the worker? In terms of showing up, what are the rules like that require somebody use their time off or lose that time off? There's often here at least a pattern where we have people work really hard, we give them time off, but then we don't allow them to use it all, or that we force them to use it by the end of the year. Do they have to claim that they're sick in order to use their time off? So some of it's put in a sick bank, and so the healthy people actually get fewer days off. Do they have to take a set number of days, or could they cash some of it in? Do I have to quit in order to get paid for unused sick time? And do I have to stay out longer in order to qualify? So is there a waiting period where I actually am incentivized to stay out longer in order to retroactively get paid? And so one of the things that the human capital equation helps us do is recognize that employees are worth more when they're present than when they're absent. And it seems funny to say that, but we often have situations where the policies encourage people to be out, and employers don't want to pay people more to be there. So we should have a value to being present, and that employees should share in that value. And those who do show up more often and show up consistently and stay healthy in ways that keep them at work and performing well, that there is a reward to that. And then lastly, if a person remains healthy or improves their health, can they earn a bigger bonus or qualify for more overtime or be able to get more opportunities? So does being healthy mean something? We did a study in one organization where the #1 predictor of flu shots was whether or not the person could earn a bonus or overtime. So the individuals who knew that being out of work would cause them a consequence in terms of potential earnings were more likely to get the flu shot. Can they get paid and a value for avoiding illness? As I said, the flu shot example. Can I build up money in a health savings account, which probably doesn't apply for those of you north of the border, but can somebody in this case share in the medical savings and keep that money? And can being healthy give me more opportunities because I have I'm there, I'm alert, I'm focused, and I'm doing well? And so do people recognize when I perform well? Am I given an opportunity to advance? Are we rewarded in non-monetary ways that actually matter? And so in many cases, I do assessments of organizations where I plot them along a dimension of shared rewards, which includes things like profit sharing and bonuses and training and cashing in paid time off and savings accounts and retirement, and shared responsibilities, which includes how they manage time off, whether or not they are given performance pay instead of a cost of living increase, and a variety of other things. And so what we're trying to do is set up a strong incentive to stay healthy, be at work, perform well, avoid injury, practice safe practices, produce high quality work. And that what we want is all of our policies to provide incentives for this. We find that in organizations where an individual can't earn more for doing better work, isn't recognized for staying healthy and being a good performer, that we see much higher rates of benefits use, both time off, also workers' compensation, and healthcare utilization. And that is not directly proportional to health. It's directly proportional to that person's feeling that they are rewarded at work and that there is opportunity based on how well they do. So, of course, it's an important connection, again, between health and benefits costs. But in our feeling is that it's much more important to be thinking about broader human capital assets and broader business performance in ways that help you connect these other influences rather than simply focusing on health status or specific injury. So the way that we look at these problems determines the kinds of solutions that we find available to us. So every employer can identify the important business performance metrics that leadership and business owners are trying to achieve. Every employer can start to make the links between human capital and human performance and business outcomes. Every employer can look at the revenue to wages ratio. What is it that we're expecting of an individual? The overall revenue for the year divided by the number of people and the amount of wages paid. What is that ratio? And do employees understand that for every day they work, the way that the business has to perform in order to survive, they need to produce a certain amount of revenue? And how does what they do affect that outcome? And if they do well, how will they be rewarded for that? Every employer can assess how their policies are aligned or misaligned. Every employer can start to look at how to integrate the metrics that connect people to business. And every employer can think about human capital and how to reward skills, motivation, and health in such a way that people know that it's valued, whether that's monetary rewards or just recognition or opportunity or advancement. There's a lot of ways that can happen. So early last year, we published two papers. One is the Connecting the Dots paper, which talks about these different things. One is Missing Variables, which goes into much more detail about why policy matters. And I'll conclude with attention to the time zone. Our biggest challenge is the time zone difference. In New York, it's 2:45, but at our headquarters, it's 1974. Too often, we're stuck in past thinking, and we aren't looking toward all of the new developments that are available. And the data sets that are available now are starting to be wonderful tools for helping to reinforce human capital and reward people for doing well, staying healthy, and showing up. So I will stop here, and Tanya, you can tell me if there are questions, and I'll stop.
Wonderful. Thank you very much, Wendy. That was a great presentation. At this moment, there are not any questions, but if anybody does have any questions for Wendy, you can feel free to type those into the questions box, and I will read them out loud. So we'll take just a moment and see if anything comes up.
Okay, we have them all stunned.
Apparently, it was thorough enough of a presentation that there Don't seem to be any questions.
Okay.
So I guess we can go ahead and wrap it up. And thank you again for your participation, and thank you very much, Wendy, for the presentation. It was very good, and I'm looking forward to seeing what kinds of interactions we get from people about it.
Okay, great. Well, thanks again for inviting us, and I'll be sure and tell Bruce that he's in big trouble.